morning, good morning. So first order of business today is to welcome Professor Jenny May, Chair of the Recommendations Committee, and she's going to update us all on what's happening in the sharing shed. Take it away.
Thank you. Good morning, everybody. Let's go back one. So, first of all, a big thank you for those of you that have participated in the recommendations and the sharing shed process. I have to say that we are definitely better together, but our IT isn't. So many people have had some difficulties getting in and staying in. It seems to be that it doesn't like people's passwords, and then you try and log back in again and it doesn't do what you want. And so, as I said, if there are things that are burning issues that you want to be brought through, we'll be beavering away in that recommendations little room just adjacent to the reception, but we will be closing off the recs around 10 a.m. so that I can get you a fairly firm draft for this afternoon. What you'll see that I'm about to put up is definitely a work in progress and a working document, but I think we've bedded down the major themes. So I guess my other comment is that it's very tricky to get that balance right. The recommendations process gives us an opportunity to have a voice, and a voice from the sector and from the floor, but then sometimes I read the recs and I think it would suggest that nothing's happening in the rural and remote sector, and that is so far from the truth. There are so many good projects and good things that we've seen over the last few days, and that we know that on many indicators, the health of individual rural and remote Australians has improved and is of quality. What we don't have is that standard that runs across the sector that says that we can, and in Beau's words, let's lift the level of access across the sector to safe housing, education and culturally appropriate healthcare so that young people don't have open heart surgery as a consequence of poverty. And I thought that was one of the very key and enduring themes of that first opening plenary. And the second quote that I've given you is from Sir Harry Burns, and that was very much urging us to think forward. And as I said, in the recommendations process, what we're looking is ways in which we can improve, and we can improve as well as you'll see with the recommendations, lots of exhorting government to do things. We, on the ground, in our various occupations, doing our various things, are so much part of the solution, and many of our speakers have given us that perspective, that unless we co-produce, co-create, we are not going to change the health inequalities that we are aware of. And finally, I thought that one of the recs that came in last night was particularly useful, and that is that we do and we need to affirm our diversity and inclusivity in rural and remote, and that we do and we ask to be part of the solution, but not just at the solutions end, but in the policy discussions and the determinations that are being made on behalf of rural Australians, and obviously segueing into our first recommendation, that the involvement and leadership of Aboriginal people in their own destiny is something that we as a sector need to affirm. And it was very strongly, and if you have a look in the recommendations portal and you look at the recommendations, overwhelmingly conference delegates have endorsed the Uluru Statement and called on all political parties and all governments to engage in a process of, and I thought these words were very poignant and useful, truth-telling and agreement-making to eradicate discrimination, racism and improve, as a consequence, health and well-being. The second recommendation, which is a compilation of a number of recommendations that you will see in the sharing shed, again picks up Beau's comment about surgical solutions for social problems and talks about the primacy and the importance of committing to comprehensive primary health care. And again, we've heard about that theme through many of the presentations, both plenary and concurrent. And the third thing that has come through very strongly is the role and the respect that needs to be paid to Aboriginal health workers, and the significant challenges that operate currently in Aboriginal health workers being able to work to their full scope and to their full capacity, and that relates to funding, support and a number of other issues. So the second theme, which I'm sure you'll agree with, is the determinants of health. And we've actually split this over 2 slides. So those of you who are aware and invested in the opportunity to work towards climate change will see the recommendations on the second slide. So don't think I've forgotten it out of this first one, because I surely haven't. But what you can see is that absolute commitment by conference attendees to understanding and embracing the determinants of health as a precondition for health and wellbeing. And I thought there were some very interesting strategies that are up there. And you can see that a comprehensive national rural wellbeing strategy has been proposed. And I really liked the silo-busting words. I thought they were very apt for the way that we currently find ourselves doing business. Obviously we need to think, and Sir Harry Burns really challenged us to think about what we measure and whether we're measuring illness or wellness, and whether we actually understand and know how to identify what are the precondition and elements of a healthy community. And his work in Scotland was obviously around the early years, and you can see here a proposal for a ministerial department for the first 2,000 days of life. And interestingly, that picks up some of the cross-sectorial issues that we have heard about ad infinitum over this conference. The final recommendation also picks up on the many themes that we have been aware of through the conference about the importance of epigenetics in health and how we see negative impacts from intergenerational trauma. And we certainly need governments and all of us to have an approach to identifying and managing that issue going forward. So certainly in climate change there have been some fantastic proposals, and again I urge you to have a look at the full list of recommendations. There's about 150 at the moment in the sharing shed, and I'm expecting a few more by 10 o'clock. But the thoughts and the sentiment is very much about, again, committing at a high level, which is the National Climate Health and Wellbeing Strategy, the thought of a National Sustainable Development Unit, and then on the ground we have to think about the adaptation and the changes that will occur individually and corporately in our communities in response, and how we're going to manage the change adaptation strategies that we will need to take on if we're going to support our communities with what is ahead. So am I getting close to the end of my time? So what I'll do is I'll just take you through the next 4 slides. As I said, this is a working document. Come and put your head in if you wish. I'm going to be working on it all day, and for Senator Bridget McKenzie this afternoon, it'll be a little polished and the font will be the same size and all that sort of stuff. But we've got recommendations that are being aggregated on access, workforce, and you can see that's a very busy slide and there's more to come on workforce. I guess what I want to say about workforce is we're not saying that there's nothing happening in workforce. There are some fantastic programs that are in workforce, but obviously have we done enough? No. Is workforce a precondition for a successful health and wellbeing in rural and remote Australia? Absolutely. So it's a work in progress, and there's some very good suggestions coming through the sharing shed about how we might optimise and improve workforce. And the other thing is the enablement of workforce. So without infrastructure, and when we mean infrastructure, we mean the capital, we mean the IT, and there's been lots of recommendations around the IT, but also the social capital of our workforce. And one of the top recommendations, as well as the call about the Uluru Statement, is around investing in health and wellness and how we actually support wellbeing for our rural and remote workforce. And finally, and not insignificantly, are we researching the right things? Are we quarantining what are very large research budgets for the right things? And are rural and remote citizens and clinicians to be researched upon or researched with. And I think that was a very strong theme coming both from some of the early pre-conference workshops, but also coming through this conference. So thank you. It is a work in progress. You'll see similar, and I'll go into a bit more detail if I have time this afternoon when we present them to Bridget McKenzie, but it's us, all right? This is the conference recommendations. This is not the Alliance. This is not me. Each of those conference recommendations you will see echoed either in print or in philosophy in this priority recommendations document. So thank you.
Thank you very much, Jenny. All right, so just got a few housekeeping notes before we begin. Firstly, again, I'd like to acknowledge the traditional owners of the land on which we're meeting today and their elders past, present and emerging. I was thinking I haven't really referred to Mount Wellington or Kanani, which when you live in Hobart, you kind of get used to it. It's around so often. But when I was younger, I was entertaining a friend who was visiting from interstate and hadn't been to Hobart before. I was at university, and I'm not passing judgment on my behaviour at university, but we'd been out and we'd possibly had a few Chardonnays, and we're walking back to somebody's house in South Hobart. And in South Hobart, Australia's oldest brewery, Cascade, worth a visit, has a really big light on the road, and I said, we've just got to walk past that light and we're home. And he thought I was pointing to the light of Mount Wellington, and he just started running. Anyway. We have winners to announce of the Friends of the Alliance poetry competition, and this time they don't know who they are because we haven't told them yet, but I do. So the winner, we have two winners. First is Lance Ellis from Townsville with Hope. And second, we have Two in the Bush by Kalina Griffiths from the Gold Coast. So big round of applause for them. You can tell it's the last day of a conference because everybody has to bring their luggage to the main session. It doesn't finish till after checkout. Again, if you've got a sore head today, please give a round of applause to the University of Sydney for sponsoring last night's drinks. And again, just to acknowledge our very generous sponsors too. So the principal sponsor of this conference is the Royal Flying Doctors Service, Hester Superannuation, Charles Sturt University, the University of Sydney, Flinders University, Monash University, the Australian Government Department of Health, Flinders NT, the Queensland Government Department of Health, Starlight Children's Foundation, Caring at Home, Are You OK?, the Tasmanian Government Department of Health. See what I did there? I read them sequentially yesterday and it sounded like I was repeating myself, so I've split them up now. The Lowicha Institute. Right. There's a late change. We've got a new addition to the program today in Harbour View, Room 1. There'll be a screening of Twelfth Night, the 10th annual Shakespeare at the Tanks production by our friends from the Tropical Arts Centre in Cairns in far north Queensland. This is community theatre at its best, involving deaf actors, Auslan interpreters, actors with a disability from culturally and linguistically diverse backgrounds, children, professionals, and a wide range of skills and abilities to promote individual and community wellbeing. There's also the mental health survey. There have been some issues in distributing this, but if you check your email, it has been distributed again this morning by SurveyMonkey. And there will be hard copies available in some rooms, although I'm not privy at this time to know which rooms they will be in. So if you could fill that out, that'd be great. And lastly, and not least, Twitter, #RuralHealthConf has reached 34.5 million impressions. Our record is 50 million, so get tweeting. We want to get there by the end of today. And remember to tag our friends, Ministers Hunt, McKenzie, Catherine King, and last but by no means least, Senator Richard Di Natale. Bang, bang. All right. So it gives me great pleasure to welcome Senator Di Natale to the stage. He's the leader of the Australian Greens and he was first elected to Parliament in 2010 as the Greens' first Victorian senator. Prior to entering Parliament, Richard was a GP and a public health specialist. He worked in Aboriginal health in the Northern Territory, on HIV prevention in India and in the drug and alcohol sector. Richard champions evidence-based solutions to the major problems facing our communities today: climate change, growing economic inequality and the destruction of our environment. Richard, his wife Lucy and their 2 young sons live off the grid on a farm in the foothills of Victoria's Otway Ranges. Please welcome him to the stage.
Thank you so much. Let me begin by acknowledging that we are here on the land of the Muwinina people, as they are the traditional owners. Let's also remember that sovereignty of this land was never ceded, that this is stolen land and that we've got so much unfinished business. It's always dangerous to come and give an address on the last day of a conference, so I acknowledge that some of you will be listening to this through perhaps muffled ears. It's always, for me, a huge pleasure to be amongst health professionals and sector leaders. As some of you will know, I trained as a GP. I worked in rural and regional areas, and you learn a whole range of skills that are useful in politics. You think on your feet, you're analytical, you try and look at problems in their broader context, and they're all really handy skills in politics. Having a working knowledge of personality disorders also helps. Look, I suppose what brought me here into this gig was I spent a few years working in the Northern Territory in Aboriginal health, and you go in there with the sort of academic understanding of the social determinants of health. I was really interested in seeing the previous presentation, but it becomes very real when you spend time in that in those communities. And so for me, working in that environment, really I came to accept a very confronting truth, and that's that if we don't address the social conditions in which people live, then it actually doesn't matter what we do in healthcare, because we're not going to improve at a population level the health of Australians. We're not going to do it, because if people... That's not the response I expected from an audience of healthcare providers, by the way, but I'm really pleased. Because, if you don't have a roof over your head because you've been squeezed out of the property market, you can't get access to public housing, then that's a health issue. If you're committed to basically a life of poverty because you haven't got a job, you're on New Start, which condemns you to living in poverty, so you can't feed yourself or pay your rent, that's a health issue. If you're sweltering in housing that's just not fit for purpose because governments are too gutless to tackle climate change, then that is a health issue. And we have to address all of those things if we're going to, really improve the health of the Australian community. The problem we've got really is we've got a system that's been totally captured and dominated by very powerful vested interests, and they are the voices that are heard in Canberra, not the voices of healthcare professionals, indeed of the community. What we've got is a political system that privileges those people who donate, those people who have power and influence over ordinary people. And if we're going to address housing, education, employment, income support for people who are not in employment, if we're going to address all of those things, we need a pretty radical change in the way politics is practiced in Australia. We've got to fix our tax system firstly so we can raise the revenue to invest in those things. And we don't have a tax system at the moment, we've got a tax avoidance system. We've got to do a lot more. We've got big multinationals who pay very little tax. We hear a lot now about climate change. It's interesting that Scott Morrison doesn't talk so much about coal, despite bringing a lump of coal into the parliament, but neither side want to actually tackle the elephant in the room. Coal's the biggest contributor to climate change. Australia is the biggest exporter of coal in the world, and yet neither party's got a plan to tackle coal. not just coal that's burnt here in Australia, but the 80% of the coal that we dig up and export overseas. We need a plan to transition out of coal and to bring in a renewable energy export industry, which we know is within our reach if we make the right decisions now. They're the sort of things that we need to do if we're going to make a real difference to people's health. And when it comes to healthcare, we've got a lot of work that needs to be done. Medicine is pretty sick at the moment. I was recently reading a book called Can Medicine Be Cured? By Seamus O'Mahony, who's a gastroenterologist. And what he talks about is this sort of golden age of medicine. Began after Second World War II. It was an era that ushered in vaccines, antibiotics, new surgical techniques, medicines that actually made a very big difference to people's lives, a whole range of other surgical procedures, anaesthetics and so on. We saw huge improvements in the health of people. We saw system improvements, universal coverage in many developed countries being introduced as a policy position. And his analysis was that from the 1970s onwards, we really haven't seen that sort of progress. We haven't seen anywhere near the progress that was promised through that golden age of medicine. Indeed, he calls the current era an age of unmet and unrealistic expectations. He calls it the age of disappointment. So we've got a lot of work that we need to do to reform our health system here in Australia. Prevention's almost completely ignored. I mean, one of the first acts of this government was to dismantle an agency dedicated to addressing prevention. Again, an instructive example of the power of big corporate lobbyists. I chaired an obesity inquiry looking at what are the things that we need to do to address the rising incidence of obesity and related diseases. And what's really clear is that the junk food lobby have way too much power and influence over Australian politics. No one wants to talk about how we could restrict junk food advertising that bombards young kids. No one wants to talk about the reformulation agenda that's so necessary so that people are actually having food that's nutritious, not just loaded with sugar and salt. Same is true of alcohol. In medicines, we're seeing only very small and incremental improvements. We fund a whole lot of things that don't work, which I have to say, at least one of the things that we've seen in this period of government was the initiation of the MBS review to finally try and get some evidence into the way we fund interventions in this country. We've got duplication and cost shifting. We've got this ridiculous system where state and federal governments blame each other, shift costs between each other in a way to make their own books look good. We've got a system that's provider focused, not really consumer focused. We've got a system that rewards throughput. The more people you see, the better you're remunerated, but not really rewarding health outcomes in a way that we need to, particularly when you consider the rising incidence of chronic disease. And of course, we've now got a system that is moving away from the principle of universality. We've got a two-tiered system in Australia. Now, half the community got private health insurance, half the community don't. And that means that half the community in Australia get a different level of healthcare. And of course, it's particularly true when you consider the situation for people living in rural, regional and remote areas. About a third of Australia's population, and yet on all the key indicators, death rates, life expectancy, they're much worse. And people in rural and regional Australia have got poor access to the use of health services. They've got a high prevalence of cardiovascular disease, about 20% high. You don't need me to tell you all this stuff, that's why you're here. You know this stuff. People with cancer, poorer survival rates, people more likely to smoke, people more likely to be obese, the list goes on and on and on and on. So we actually need some pretty significant change in the way healthcare delivery is done in Australia. System, business as usual, is just not going to cut it. We've got to get real about social determinants, and again, I just want to thank you. Your voice is a very powerful one in this space. Often, the social determinants is often looked at in Parliament as some sort of ideological battle, but what we need to do is recognise that if we don't get real about social determinants, we're not going to improve people's health. As I said earlier, we need a real plan to tackle climate change, to transition out of coal and to make sure we take advantage of the huge opportunities that come with the jobs from renewables, clean air, clean water, investment, all those things that we know are flow-on benefits. We know it's going to happen, and people living in those communities that will be impacted are going to be impacted regardless of what I say, regardless of what's done right now. The question for us as policymakers is, can we do it in a way that's planned, that's managed, that actually looks after people through that transition, rather than just letting the market rip and having huge social dislocation thrust upon people. So we've got a long-term vision for healthcare. We see healthcare as an investment, not as a cost. I'm sick of this debate that says, oh, we can't continue to invest the amount of money we're investing in healthcare. It's interesting. Both parties commit to a nominal 2% target for defence spending, based on no evidence as far as I can tell. They're on a unity ticket to increase the amount of money we spend on defence, and yet for some reason when it comes to healthcare, it's all about how do we rein in costs. I think we've got it back to front. We want a system that's universal. We have to get back to that principle. I could tell you about how cost-effective universality is when it comes to at a systems level, but actually, if you're talking about basic decency, then, and you consider that healthcare is a human right, then every single person in this country should get access to healthcare, no matter how big their bank balance. So our mission is to make sure we address those things. We're going to put prevention at the heart of our health system. To do that, we're going to ensure that we tackle the cancer on our democracy, that is the growing influence of big corporate donations, the role of lobbyists, where people can't wait to get out of Parliament so they can go and lobby for the industry they were responsible for. Sometimes they don't even wait till they're out of Parliament, by the way. We have to address those issues. We need caps on donations, but we also need caps on how much is spent during election campaigns, so that it's not the big donors that are determining the policies of both major parties. We need a clear rural health strategy, and as the Rural Health Alliance and many others have been calling for, we need ongoing funding for the Rural Health Commissioner to help direct the strategy and keep rural health at the forefront, rather than just some afterthought that often happens when we hear about health reform in this country. We're going to deliver on both of those things, a rural health strategy and ongoing funding for the Commissioner. We've costed it and we're going to campaign for it. So regardless of who wins the next election, and look, being frank, I hope it's not the current mob, but we will work and put pressure on a future government to ensure that both those commitments are met. Getting back to that issue of cost shifting. You know, Australians in rural and regional areas know that the only way we're going to get progress is if we end this ridiculous situation where we've got this arbitrary delineation of responsibilities between state and federal jurisdictions, and we make sure that we start funding health on a rational basis. So we're committed to funding a single agency, one agency at arm's length from government that is responsible for funding the health system. Not one area that funds primary health care, another area that funds hospitals. We need an independent single funder that will commit to a nationally unified but regionally responsive health system. Over time, the agency will provide independent oversight of regional needs, assessments and identification of priorities in primary health care. So it's going to end the cost shifting that I think is a huge problem we've got within our health system right now. We're committed to ending the wasteful and unfair subsidy of the private health insurance industry. It's a rubbish investment. For every dollar of public funding for private health rebates, if we took that money and spent it on healthcare in the public system, we'd get $2.50 in benefits. The promise was it would take pressure off the public system. It hasn't done that. It's lined the profits of big health insurers who consistently increase premiums and decrease the level of coverage that they're providing to their patients or to their customers. And that's particularly a problem in regional Australia. You're getting less and less value out of public spending on private health insurance. Of course, we know why. If you live in regional Australia, you're less likely to have private health insurance. And if you do have it, you're less likely to be able to access services delivered through the private system. So we've got a plan for reinvesting that money currently spent on the private health insurance into our public health system. Through that extra spending in public health, we can decrease the huge inequalities that's now built into our health system, particularly when it comes to rural and regional communities, and we'll make sure that people get the level of healthcare that they need. As I said, when it comes to prevention, that's $6 billion and growing per year that's being spent on subsidising the private health insurance industry will be redirected into a prevention-focused model. It's under-resourced. We spend less on prevention than most other OECD countries. People are getting sicker. We hear about sustainability of our health system, and yet we've got governments refusing to invest in prevention. We're going to establish an independent preventative health agency, a $30 million commitment to do that, and to make sure that we keep building on the proud record that Australia has, and particularly Australian health researchers have, when it comes to delivering evidence-based preventative health interventions. We know there's no silver bullet. See, part of the problem is if you've benefited from prevention, you're less likely to be knocking on the door of a politician than if you've had to wait 8 hours in an emergency department. The timeframes for prevention are longer, and politicians don't do long-term planning anymore. So there are a lot of things working against prevention in health. We've got to address that. With dental care, we've got a plan to bring dental care under Medicare. It is utterly ridiculous that somehow it's absurd that we treat teeth as somehow separate from the rest of the body. We've got a totally different system for how we fund dental care. And it has a huge impact on people's health, has an impact on neonatal mortality, low birth weight babies, heart disease, a whole range of things that are associated with poor oral health. Of course, we know the risk of infection goes up. It's a huge social stigma for people. If you're missing some of your teeth and you're sitting in front of somebody for a job interview, you're less likely to get a job. If you're trying to get access to a house on the private rental market, you're less likely to be able to put a roof over your head. There's huge social stigma attached with poor oral health, and it's particularly bad for regional and rural areas. The more remote you are, the worse your oral health will be. Now, part of that is access to health professionals. Part of that is because people in rural and remote areas have poor access to dental practitioners. But part of it is that people in rural and remote areas have lower incomes, and cost is a major barrier to accessing dental care. A third of adults report that they don't go to see the dentist because of the cost. So our Denticare plan is straightforward. It's going to be phased in. We start with people on low incomes, people who are benefit recipients, but we will introduce a universal dental scheme. $1,000 over 2 years so that people can have basic preventative treatment, scale, clean, topical fluoride treatment, fillings, extractions, dentures, all of the things that we know are very important to give people access to a decent quality of life. That plan, we got the first plank of it in 2010. When we had the hung parliament, I remember sitting opposite the health minister, and one of the things that we agreed as part of our negotiation to support Labor in government was to begin Denticare. So young kids now, 80% of children under 18 get access to a version of Medicare-funded dental care. We want to expand it. We want it to be universal. When it comes to primary health care, we know that you are the centrepiece of our health system, primary healthcare providers. And that's particularly true in rural and regional areas, where healthcare providers are the cornerstone of the community, a critical piece in keeping people well, and actually connectors within your communities. So we have to do everything we can to support your work. We've long supported and will continue to support the rural generalist pathway. It's essential in helping health professionals train and stay in the regions and to help Australians get access to the healthcare that they need. But we want to support looking at how we get that rural generalist pathway extended into allied healthcare professions and other ways in which we can support allied health in rural and regional communities. We want to work with you to develop the right model. We want your interests represented in Parliament. The last election, we took a commitment to reform primary health care for people with chronic illnesses, including people with mental ill health. Our plan is to fund GPs to coordinate care so that they're paid for outcomes, not just throughput. There was some promising work at the start of this period of government in the healthcare homes trial. We looked at that, we had an open mind. We thought, finally, here is a model that looks at how we might fund primary healthcare in a different way. Let's keep an open mind on that. It was underfunded and it was poorly implemented. So we want to see a system where this coordination role with GPs works in rural and regional areas, where people can travel between specialists or navigate telehealth, and we're announcing a big commitment to investing in telehealth as well. Drug and alcohol is another area that I'm personally very committed to. Having worked as a drug and alcohol practitioner in a regional area, we need to do better to support people who get into trouble with alcohol and other drugs. When people come in to see you as a practitioner, they're coming in to see you, and often there's a very narrow window in which you can act, and if you can't provide support for people then and there, you often lose them, and sometimes lose them for good. So we've worked very hard to ensure that people get access to decent drug and alcohol counselling services, inpatient facilities, rehabilitation and so on. But we actually need to do more than that. We've got to start recognising the issue of illicit drugs is a health issue, not a law and order issue. And worldwide, we're seeing the tide turn when it comes to the way we treat drugs. In Australia, we've finally seen the government accept that medicinal cannabis has a role, but the system they've implemented isn't working. We want to make sure that medicinal cannabis is used as a treatment for those conditions where we know it works and where people don't have to jump through a whole range of hoops to get access to it. We've also seen recreational cannabis now legislated in a number of states within the US, in other jurisdictions, in Canada, New Zealand about to have a referendum on it. Our view is that we would much prefer this taken out of the hands of criminals to be put within a regulated market so that people who are accessing cannabis, and they'll do it regardless of whatever model we've got in place, are at least accessing it from a health professional, from somebody who's trained, for somebody who can provide them with the support they need if they're getting into trouble with their use. We want to create regulated environments that are safe and accessible, that drive the trade out of the shadows and into controlled environments, environments that promote and support health. Let me just finish by saying again that we do need a big shake-up of our health system. We have to get the money out of our politics, and we've got to get your voices in to our parliament. We have to make sure that we understand and that politicians understand that social determinants are critical in influencing people's healthcare. We have to get real about climate change. And right through this election campaign, over the next couple of months, I'll be making sure that every single moment I have an opportunity to speak to the Australian community, we'll be telling them about the challenge that we face if we don't address it, but the huge opportunities that come with embracing that challenge if we do. And that starts with a plan to phase out coal. We're going to talk about what real healthcare reform looks like, not just tinkering at the edges. Look, it's a great thing that the Medicare freeze has now been, there's a bipartisan view that it was a mistake. Let's not forget though that there was a bipartisan consensus to implement it. Started by Labor, followed on by the Liberals, and now there's an understanding that it was the wrong thing to do. But if anyone thinks that a comprehensive policy for healthcare reform in this country is not freezing Medicare rebates, they've got rocks in their head. We need to do a lot more than that. So I hope to keep working with you in the lead up to the election. I want to keep hearing from you about what we need to do to improve our health system. And I hope we can be partners on a journey that takes the social determinants of health out of this forum and into the Australian community. Thanks so much.
Thank you very much, Senator. And Senator Genitale will be coming back with our other two presenters for some Q&A for 15 minutes at the end of the next two presentations. So if you want to ask a question, have a think about it now and then jostle for the mic in half an hour. All right. Our next presenter is Dr. Kulinda Griffiths. She has one of the coolest titles I've got to read out from a presenter at this conference. She's a Centre Fellow, Centre for Big Data, Research in Health at the University of New South Wales. Kulinda is a Yarraboo woman from Broome in WA with Indonesian Welsh heritage. She's an Honorary Fellow at the Menzies School of Health Research and also holds a Centre Fellowship for the Centre of Big Data. All right, Joe, you've already read that. She was named after a boat that her grandmother was born on off the coast of Western Australia, the Kulinda. And best fact of all about this bio, Kulinda used to DJ hip-hop. I was watching a doco on hip-hop last night with my parents and they still don't get it. And she reckons she could still rip out a kickflip. And I used to skateboard a bit too. I reckon it might take me longer than a week to get back there. So please give her a warm welcome to the stage, Kulinda Griffiths.
Hello everyone, Senator, special guests, and a big thanks to the National Rural Health Alliance and their supporters for the conference and to have me here today. Before I begin, I would like to acknowledge the traditional custodians of the land on which we're meeting here today, the Mawina people. I would like to pay my respects to all elders, those of the past, the present and the future. I would like to also pay my respects to other Aboriginal and Torres Strait Islander people in the room and other Indigenous peoples who have travelled far. So, Naya Nilawa, Kulinda Griffiths, Naya Yawu Jandu, Jawu Buru Rubibi. So my name is Kalina Griffis, my family name is Corpus, and I am a Yawu woman. My country is in Broome in Western Australia. I also happen to really like data. I am an epidemiologist at the Centre for Big Data Research in Health at the University of New South Wales, where I work on existing population-level data sets. And I do that so that I can better understand why some populations are healthier than others. I have a specific focus on Aboriginal and Torres Strait Islander peoples, and I work across a range of different programs and projects. And so my interest is in the usability of existing data and big linkage data for the purposes of research and community development. And I'm particularly interested in the quality of the data being used, what we're measuring, and how we're actually measuring it. Every single session I've been to since I've been here has mentioned data. And every person who's mentioned data has actually mentioned it in a different way to the person before them. So we really are in the data era, and data is important for the future of understanding distributions of health and wellbeing within the nation. Whether it's mapping healthcare services or utilising community-level data to report on community priorities, data and the way in which it's used actually plays a massive understanding in our understandings of health. So what we're going to do here today is map out the landscape of existing population-level data, and we're going to do that in describing disparities in Australia and how data can be actually used as a tool to drive rural and remote health into the future. So I think I'll highlight some of the important concepts and matters arising that I've seen here and throughout the years as well. I do want to preface a couple of things though. Firstly, that I use the term disparity purposefully. And I use it because it highlights an implicit assumption that the differences that we see between populations can actually be due to social injustices, so inequities, and not only and as well as the variation between the equivalence between two different population groups. So we're talking about inequalities. And when we do talk about rural and remote health data, we're actually talking about Aboriginal and Torres Strait Islander health and health data. So I just want to touch on Indigenous data sovereignty, but we're not going to go through it today, but it's important to recognise that Indigenous data sovereignty should underpin governance arrangements when we utilise data. So I am going to be straight up with you. I really, really love data. I like seeing the trends in data. I like seeing the emergence of information. To me, it's like art. I also love it because it can also be an incredibly useful tool in challenging health disparities. I actually see data as one of our most critical and powerful tools to advocate for and to make positive change in society. However, data utilisation for the purpose of disparity measurement in population health isn't for the faint-hearted. It bridges the world of the social and the analytical, and it only tells but one story at a time. It requires that those who undertake the work realise and respect its context and have enough knowledge and expertise about methodologies and statistics to explain what the data is actually saying. But nothing to do with love is ever straightforward. There are a number of issues that do require our consideration. So data matters. In fact, in Australia, data mattered so much that the Commonwealth Bureau of Census and Statistics, now the ABS, and its subsequent Legislation Act was developed less than 5 years after Federation. We knew we needed to be counted. And data matters because it tells us who needs what and where. And data matters differently to different people. For Aboriginal and Torres Strait Islander people, the right to be counted arose through advocacy and the moral imperative of non-Indigenous Australians. Australia held a federal referendum in 1967 in order to include Aboriginal and Torres Strait Islander people in the census counts. This means that the inclusion of Aboriginal and Torres Strait Islander people into Australia's data was developed within a colonial and racialised context. What this has resulted in are coloniser-sanctioned forms of recognition. While the recognition of identity, so who we are, can be achieved by Aboriginal and Torres Strait Islander people for Aboriginal and Torres Strait Islander people, we need to be cognizant that the recognition of indigeneity within data has historically been granted by governments. And this obviously raises tensions. And data matters also because we have the right to be counted. We all have the right to be seen, regardless of race, locality, or language. And if we aren't counted in the data, then we effectively don't exist. So the data ecosystem incorporates all of the data collections, legislations, regulations, infrastructures, and systems that use data. This is a somewhat simplified version of that. However, despite its lacking reflection of our complex reality, we do need to speak about the different types of data that we can use. Each data set in this ecosystem has its own purpose, which makes it unique. Each data set also has its own limitations. And some of the data sets are national, some are state or territory, some are community controlled and community owned, and some are stored within research institutions. They include the census, which is taken every 5 years. It can provide us with demographic profiles of the nation. But this means, with the census, we can also use this data set to assess rates of disease. We can do that by age, sex, indigeneity, and we can also then look at intersecting factors like socioeconomic status and remoteness. Vital statistics are collected at birth and death through the state and territory registries of births, deaths and marriages in each state and territory, and this data should be able to provide life tables that are important for life expectancy estimates and survival estimates. There are pointed limitations to the use of births and deaths data when addressing Aboriginal and Torres Strait Islander disparities, and I'll talk a little bit about this shortly. But also we've got survey data, and such as the ABS's National Aboriginal and Torres Strait Islander Health Survey or the National Health Survey, and it can provide context-specific cohort information. The exciting thing about surveys, I think, is that people can create their own domains of value. That means that we can figure out what it is that matters to us, and we can ask people in our communities about that. Administrative data includes all the data that comes from hospital, notifiable disease registries, primary healthcare, community-controlled organisation, and administrative data gives us our information on the people diagnosed with disease, and it tells us who are actually accessing services. Research data is collected for the purposes of research and usually provides answers to a specific question. But research data can also be stored. It also includes biological samples, and it does that in accordance with people's wishes. However, we are in the data era and open source data is on the table for discussion. Each of these data sets are tended to by data custodians, and there are different laws and requirements around each of these data sets. Some of these data sets can be linked to each other, and we've heard about data linkage a few times. And there are some important reasons for data linkage, but for me, I see its power in being able to move the discussion of health beyond the conventional indicators, such as like mortality and incidence, into the social and cultural determinants of health and well-being. However, if I wanted to get my hands dirty on a linked data set as a researcher, I'd need to have approval from all the data custodians in each jurisdiction. I'd have an ethics sign-off from each of the jurisdictions, and usually I'd have to have quite a big wad of cash, usually into the tens of thousands of dollars. The first national linkage project I was involved in, it took 18 months to get a hold of that data. Governments, however, while having to adhere to their own regulations and rules, do not experience the same sort of costs or delay in data use. This is resulting in a very important shift in the way in which we go about using data, our data business. The development of partnerships between governments and researchers and service providers and communities is now the way of the future. This way, instead of getting a single-use data linkage set, there is an opportunity to develop things like updating longitudinal data sets, which is pretty cool. In fact, I have been involved in 2 linkage projects, both looking at child health, that have done exactly this, and they've both been incredibly successful. There are also quite a number of data challenges. Here we touch on 2 that I think require our immediate attention. The first challenge is the lacking data nerd workforce. There has been a heap of support for data infrastructure. However, you can spend lots of money on infrastructure, but if you're not investing in the workforce to be able to use it, then you cannot begin to have that infrastructure fulfill its potential. There's also a paradox to this data challenge, and that's that data's growing exponentially, infrastructures can be built relatively quickly, but building a socially and culturally conscious data nerd takes a bit of time. Just between you and me, I would like to be involved in creating that next army of data nerds. I think we have a lot of potential in Australia, and we are investing in that next generation. Data plays an important role because we all have health, economic, social and environmental and cultural rights that cannot be wholly addressed if there are large gaps or inaccuracies in reporting in certain regions. The past few years, we've been learning about the picture, it has been the past few years, but particularly the past few days, we've been learning about the picture and progress of rural and remote health across Australia. However, when it comes to the data, there's a real requirement to ensure that people are actually counted, which brings me to my second challenge. There are some serious concerns across the range of data sets regarding the accuracy and the quality of data pertaining to Aboriginal and Torres Strait Islander people. So, for example, the quality of Indigenous status within administrative data sets is relatively better in rural and remote regions. However, that's only if people are actually counted. I'll explain this a little bit more. Here we see a vital statistics example. So Aboriginal and Torres Strait Islander births within a number of states and territories are critically underreported, not counted. We know that there are large numbers of Indigenous births missing from official statistics used for reporting purposes. To identify the issue of birth registration underestimation, 2 data sets are usually looked at. One is the perinatal data collection, which holds information about obstetrics, delivery and perinatal outcomes. And this data is collected in each state and territory from the midwives and other staff who use the information collected from mothers and families and hospital records. The second is the birth registration data collection, which is the information given to the state or territory registrar of births, deaths and marriages, usually by the parents or guardians after birth. The data captured by registries can vary by state or territory, which can also impact consistency in the information provided. Nationally, we know there's about a 5% under-registration of births when linked to the perinatal collection. However, when this is looked at by Aboriginal status, the rates increase to 17% and 18% under-registration in Queensland and WA respectively. Furthermore, if this is looked at by remoteness, The proportion of under-registration of Aboriginal and Torres Strait Islander babies in remote and very remote areas is up to 23.4% and 27% for Queensland and Western Australia. These estimates of under-registrations mean that 1 in every 4 Aboriginal and Torres Strait Islander babies and babies born in remote and very remote areas don't exist. So what do we do about it? Well, aside from the fact that birth registrations enable the rights of citizenship to be enacted through birth certification, the good news is that the move towards data sharing will be able to pick up those people who access services. And this is through linkage. So as an example, a baby may not be registered, but may be picked up by the GP data or the education data. We need to have a better understanding of what data is being used to report what. Should registration data be used for international reporting, or should we be enhancing it with other data like the perinatal data set? So pulling together just a couple of the things that I've mentioned here today, we'll conceptualise it through this diagram. Data in Australia is pretty good relative to other nations, although much of our gaps exist in actually getting counted. People have the right to recognition, the right to be counted, and this is particularly important in the rights of citizenships in Australia. This can only be met, though, with accurate counts. Distribution of services. Governments and systems should be supporting this. If you aren't seen, then you don't exist, and if you don't exist, then you don't have any needs. But this doesn't mean that we can't incorporate the next steps in driving data forward. We also need to talk about operations. How do we best build those capabilities of the next generation of data nerds? I want to see a bunch of data nerds who work across all sectors, and they know the ins and outs of each of those data sets. They know the ebbs of flow and what it's like to actually get your hands dirty and delve into the data. They would know the difference between community level data, whole population level data, and what statistical methods can be applied to both. We also need to see who's setting the priorities in regards to health measurement to benefit the aspirations of regional and remote Australia and its communities. We need to always be asking the question, who are the we in this discussion? When it comes to population level data and setting priorities, who should be representing whom? And what is it that we should actually be measuring? And finally, we need to focus on monitoring. How exactly are we doing? We have the ability to be reflective and reflective humans. And while I certainly don't have many answers at all, I think that we do need to speak about data as a concept, as a topic, much more. And I also think that we need to be like water and adaptable to these changes in the data ecosystem as they may arise. These are, after all, these data are what is going to reflect us as peoples within Australia. So I think undertaking the next steps in system reform to drive this very clear goal and priority of equity in rural and remote Australia, it actually requires us to bust open all of those silos that we've kind of been living in. And it means that we're going to be working together, and we've got some pretty good examples of how that's going into the future. So I'll leave it there. Can I ask if I can grab a selfie of you, Mob?
Do you want me to take it?
No, I'll do a selfie. Come on.
All right.
Yeah.
Thank you very much, Kulinda. All right, so our third and final speaker this morning is Adjunct Professor Cassandra Goldie. She's been the Chief Executive Officer for the Australian Council of Social Services since July 2010. Cassandra has a PhD from the University of New South Wales, a Masters of Law from University College in London, 2014, Cassandra was voted one of Impact 25 most influential people in the social economy. Again, sounds like a really cool list to be on. And was recognised by the AFR, the Australian Financial Review, in 2015 on their annual Overt Power list. Please be very careful in welcoming Cassandra to the stage.
That's always, I always go, gee, I wish that was true, because I've got to say some of the things that we'll be talking about this morning are some of the things that we really want, and we're certainly still working on how we're going to get them. I thank you very much for the invitation, and I acknowledge country and pay my respects to the Mawina people and all the First Nations people in the room here today. Elders, Kalina, wonderful, really, you know, such great work. And I also acknowledge that I think we've got a big mob meeting in Canberra right now with Pat Turner and many of the First Nations organisations, again facing up to the Commonwealth Government to demand partnership, control and the ability to drive First Nations' own futures. So let's all send them very, very big warm wishes and more power to the amazing leadership from First Nations communities across the country. Look, I've got to say, Richard and I do cross paths occasionally. Can I assure you that Richard and I did not swap notes on our speech, but can I say there will also be some very consistent themes. I did want to, we're of course a week out from the federal budget, if you woke up this morning and you were listening to the radio, you'll have heard a few things like inequality is not a problem. Thank you, John Howard. Also, that the best thing we can do for the country at the moment is to deliver more tax cuts. I think we've got a different view. So I did want to help to arm us again with some of the big picture about where we are at actually as a country. I'm just going to check that we're up and running. Okay, great. Let's just remember this. We are actually now the wealthiest country in the world. Credit Suisse does this annual wealth global report. Last year, we finally pipped the post of the Swiss. So when it comes to net household wealth, median household wealth, we have the greatest of any country in the world. But this is the other side of the coin. Because we will talk about tax this week and we'll talk about tax next week in the federal budget. Let us remember that in terms of overall revenue, the collection, the revenue base that we collect, we are still the 7th lowest in the OECD in terms of the revenue base that we currently have, and I will come back to that. Look, I want to acknowledge that we now work very closely with the University of New South Wales, Kulinda, and other academics from UNSW in producing. Fran Boehm is a part of the advisory group on this work. We now consistently provide for you and for the Australian community an ongoing solid evidence base about what's going on in terms of relative poverty in Australia and also income and wealth inequality. So the latest report, which was out last year, confirmed that we still have 3 million people living below the relative poverty line, and that includes 740,000 children, and that with those households affected by living below the poverty line, there's a couple of big themes that have really come out, and I'll come back to it. One of which is that for households that are living below the relative poverty line, almost 40% now are relying on wages for their income. And we've got a discussion going on about minimum wages right now. So I do want to speak to Mr. Howard, to John, through the mic. Inequality is a big problem in Australia. And if you don't think it is, then you're obviously living in a very particular world, which does not resonate with the majority of people in the Australian community. So this analysis is also from the work that we've done with the University of New South Wales. And I might just quickly go to the really big underlying story which is directly affecting health outcomes for people, which is the big change we've got going on in terms of wealth accumulation. So since 2003, for people in the top 20%, there's been a massive increase in wealth accumulation, so over 50%. For people in the bottom 20%, the wealth accumulation has declined by 9%. And so this is a combination of what's happened over you have wealth, you're in the property market, happy days. If you weren't, it's not. And of course, also because of the slowing of income growth for people in the bottom 40% of the community, the fact that people on very low incomes are not getting anything at all, in fact, are dissaving in the jargon. People in the lower 40% in the income bracket are also not in any shape or form being able to get wealth behind them. And of course, that plays directly into chronic ongoing stress and anxiety, which directly affects health outcomes. So this one, of course, has been a persistent, thank you to the Alliance, persistent theme, of course, through the conference about the direct effect that poverty and inequality, the social determinants, have on poor health outcomes. For me, it was really, in thinking through what I was going to talk about this morning, it was again really good to go back to the World Health Organisation's work. The toxic combination of bad policies, bad economics, bad politics is in large measure responsible for the fact that a majority of people in the world do not enjoy good health that is biologically possible, and that social injustice is killing people on a grand scale. And that applies in the Australian context. Of course, again, this has been a really important theme for this conference, as you would expect, and you've had some, I know, really excellent analysis through a number of different lenses about why we all know that the inequality lens needs to be applied to the question of where you live. And I want to assure you here that ACOS will continue to make sure that that is a key part of the way we look at some of the big policy and advocacy work that we do. Working with the Country Women's Association, with this alliance, it's really key for us to lift up continuously, particularly as we see what's going on in the regional areas, with a deep scepticism growing about what is being delivered by the major parties, and we saw that in the New South Wales election. I think this is absolutely a time for the voice of people from regional areas to really lift up and to, as Richard, you put it so beautifully, the thing about bringing the community into the parliament. I am going to ask you to commit to do a few short things while you're sitting there. Most of you have a device with you. We are heavily involved in the campaign to finally get an increase to the New Start allowance. We've been involved importantly also about talking about the significance of needing to increase the minimum wage, and that's absolutely correct. Yesterday I was also saying in the media that we support where Labor is going with wanting a new assessment of what the minimum wage should be for it to be a living wage. I noted, of course, that households now, 40% of those under the poverty line are relying on wages. But the minimum wage at the moment is $37,400 per annum. New Start is less than $15,000 per annum. Okay, so there is absolutely no question that the most urgent, immediate thing that needs to be done is to lift the base rate of New Start and to fix it to wages. We have a campaign which is now a lot of philanthropists are involved. There is a big push to finally get the major parties to commit on this, and I really would urge you to get online even while you're there now and to join the campaign, because this is what it looks like. This is the trajectory over this is the income changes that have happened since it's 1993, the start point, up to 2017. So the red line, the deadline, is New Start. Yeah? The minimum wage is the one in the middle. Okay? So we need both, and we can absolutely afford to do it. For those of you who are working in the community with particular profiles of family individuals, just to check that you're across this too. Because of a range of budget-cutting, nasty vilification policies in some cases, we've now got 1 in 4 people who are not eligible for the DSP anymore, but with a partial capacity to work are now on New Start, $40 a day. Budget saving. That's what that was about. There's no question about it in our view. Similarly, we've got 110,000 single parent families living on New Start, and in our analysis, our poverty analysis, the really nasty increase in poverty rates has been amongst single parent families, of course, single mothers mostly, and their children. So if you're currently a single parent, single mother, not participating in paid work and you're on New Start, 60% of you are living below the poverty line. And if you look at all the children who are in the care of single parent families, 40% of those children are living in poverty today in this country. It is an absolute shameful disgrace, and as we have said at ACOS persistently, that the pursuit of a surplus, the cutting away of the social safety net, under the guise of needing to restore the budget to surplus, has meant that predominantly those that have gained over the last decade have been wealthy men, and those that have paid the price, it's been done off the back of low-income women and their children, and I don't think we should mask that fact anymore. So, look, we should be passionate about ending poverty in Australia, including amongst 740,000 children. It also is very useful for us to be able to face up to those that say, but we can't afford it, to say, but it's actually the most important thing you can also do for the economy, which is to lift up the incomes of people in the bottom 40%. And that is because when you put money into the hands of people who are so-called dissaving, you put more cash in the hand and it goes immediately into the real economy. It goes into the local shops, it goes into the IGA, it goes into regional communities directly. Deloitte Access Economics has done this work with us to show that in fact there is a long tail of economic gains by the investment that you make in lifting up New Start, including stimulating 12,000 new jobs, and increasing wages and profits by 0.2%. And that is why we've got broad support from the business community, economists, the union movement, community organisations, everybody, to say that the single most important spend in the budget is to fix New Start. But I want to move on, because there's also housing. Richard, quite right, we know, and what has happened here is that no major political party has yet done a proper investment for decades into, with the exception of some work that was done by the Rudd government, I must say, into low-cost social housing. And I think we have to face up to the fact that that is mostly politics. The economic stack-up, debt financed from government, public housing, right across Australia, into regional areas, communities, creates jobs, provides the most important social determinant, which is a great, decent, safe place to live, including in remote areas. It is about the stigmatisation of government being involved in building public housing and the not in our backyard situation. That is our view of it. Of course, for us, it's really important that we push back on that, and I think increasingly reconnect with generations coming through who absolutely understand that there is a key role for government in providing you with a place to live. You know, it is the real basics. And so we've got, I think, a fantastic campaign, Everybody's Home, which is up and running. There is significant gains being made in that in terms of the public discussion about housing, the fact that we've got very little pushback on the housing tax concessions from the broader community, not from some of the powerful interest groups in the property investment market, but in terms of rolling back negative gearing and the capital gains discount and reinvesting the dollars that you save from those overly generous tax breaks for property investors speculating in the property market into large-scale growth in social and affordable housing is an absolute no-brainer, and we will get there. There are a couple of the big policies. I wouldn't want us to lose sight, of course, of how crucial the message that is persistently, beautifully delivered by First Nations around how vital it is for there to be community control over future and development to secure sustainable improvements in health and wellbeing, tackling poverty and inequality and disadvantage, is kind of everything in the end. And so we will persist in pushing back against top-down policies, centralised place-based initiatives that nobody wants forced on top of you in a particular locality, and instead continuing to push to breathe real life into the notion of so-called people-centred design or community-driven. There's a lot of jargon going on. I put those up there a bit carefully because I know we've got some shocking examples of commissioning, shocking examples of co-design, but we know what we really mean by it, and we must stay the course on persisting in how we get that kind of community-driven, community and economic development approach to service delivery, including in regional areas where there is so much really sharp focused community capacity and leadership, knowing exactly what you need to deliver in order to tackle some of the health challenges that you see. So look, I wanted to use this as the opportunity for ACOS, having consulted, including with the Alliance and many of our other members, to again put out into the public arena today. We'll be doing a press conference, and I've done some media on it already, about what we think are the big policies that we would push in this period as needing to start to tackle the health inequalities in the system. Of course, we completely agree with you, Richard, this notion that, you know, the health system is one where we should be always cutting away looking for savings, when in fact health and wellbeing is kind of everything for a nation. But we do think there are some really decent savings that we could make within the very poorly designed health system that we've sadly built up, which we could immediately reinvest to get much better outcomes in terms of pricing in the health system and also access and equity. And so we have unashamedly called today for a $3 billion investment in promotion, prevention and community-based health services. I mean, we just take one example, what's happened with the mental health system. You know, several decades since deinstitutionalisation, and we have never had the proper reallocation of the dollars saved at that period put into the community setting where it should be. And that's just to name one area where instead, over the last, certainly under this government, community-based services has been seen as a place to cut. We've had almost $2 billion cut out generally of our community-based service delivery. We are proposing that initially anyway, to get the engine room of the $3 billion into the unleashing these resources into the community environment, that we would help for that to be financed through finally the introduction of a tax on sugary drinks. Let's just do it. please let us just do it, and also properly tackling the inadequate taxation of cheap wine and cider. So we get a good indication in terms of tackling two of our major health challenges in Australia, and we help to finance the initial stage of good investment in promotion and prevention. Dental care, agree. Look, the private health insurance rebate should go. Now, we are chipping away at it. The community understands this. There's always a tipping point where, in a daily way, people look at it and they go, this does not stack up for me, in the same way as what happened with the housing tax concessions a few years ago. So I just urge us to stay with this and to demand that every dollar that gets saved from everything that's done to claw back the subsidisation of private health, which is pushing prices up, is reinvested into the public health system, and the same for the extended Medicare safety net. I suspect I'm getting a wind up. But before I wind up so that we can talk together, I want to come back to tax for just a moment, because look, I know probably many of you in this room have been in those places where you get told there's not enough money, we can't afford it, we've got to find savings, etc. So I've given you the big picture, but I also want to make sure that you're across what this government has done in terms of tax cuts already. We're about to have a federal budget handed down next week where they're likely to propose some more tax cuts. So we've already, now, let's talk about incomes for a moment, because it's all about wages and where you hit, where you get a benefit from a tax cut. So the median wage is about $55,000 in Australia. So 50% get wages less than $55,000. So we've already spent $8 billion per annum, on delivering a tax cut for people earning $80,000 or more. And then we went on to spend $144 billion over the 7 years to introduce one of the biggest packages of personal income tax cuts this country has seen. And when that is fully implemented, it will cost the budget $11 billion per annum just to give the tax cut to people in the top 20% of the income brackets in this country. Now, that's $11 billion a year. So if anybody says $3 billion, you're crazy on preventative health, say, what about the $11 billion? If anybody says you're crazy, you can't afford to increase New Start, which is about $3 billion, this is where the money lies, and we are making choices in the Australian Parliament. There is a reason, in our view, that the current government is not getting where it would like to be in the polls, and we think that is because the community is really smart. The community sees the choices that are being made, and the community wants a different picture, which provides for us a community which is based on love, care, and really good policy. Thanks.
All right, thank you very much. I'd like to invite our two former presenters back to the stage to take a seat. We've got approximately 15 minutes for Q&A, which personally I'm hoping will be less controversial than Monday night. Check, check. So if you do have a question, start making your way to one of the fixed microphones at either side of the auditorium now. Well, I'm going to hand over the mic because nobody's going to be asking me anything.
Wow,
we're waiting, can I just, for those who are ACOS members, and there's quite a few of the community health organisations that are members of ACOS, we're right now gathering the signatures across the community opposing more tax cuts in the federal budget next week. So in case you missed it, can I just encourage you to sign on to that letter to all the senators? You'll be getting yours. Richard, I suspect you're not such a problem. And if any other organisations are in the room and you would like to be a part of that joint letter, I certainly will be staying around for a few hours, and it would be great to get your name to add to the list. Thanks.
Sorry about my voice. I just want to ask about Aboriginal health, and particularly Richard and Cassandra, what your commitments are around Aboriginal health, especially in remote areas where the gap looks like it's actually widening rather than closing.
Sorry, was that directed at me?
Or both of you, anybody who wants
all
to
the
answer.
panellists, okay.
Yeah.
Perhaps I can start. I always go back a step and talk about the need to actually get decision-making driven by Aboriginal people, and I suppose the first thing to say there is we do need an Aboriginal voice enshrined in our constitution, and we do need to establish a representative body to ensure that governments are working with and not basically driving policy on behalf of Aboriginal people. So you've got to get the decision making right, and my experience, I've said this on Closing the Gap days, as somebody who went to work in an Aboriginal community and thought they knew everything. You know, I was young and sort of, this is what we need to do. And the first lesson I got was just, you've got to work with people, and there's a lot of knowledge, and we've got to work with that knowledge, and we've got to empower people. And so I don't want to give you a sort of long laundry list of all the things that need to happen, but so getting the decision-making structures right, going back a step again to addressing some of the unfinished business, treaties, sovereignty, and so on. And I think, again, if we're serious about the social determinants model, we have to go back and address that unfinished business. And then the next step is a real commitment to invest. And there's this mythology that we spend all this money and it's wasted. And actually, if you look at the health burden and how much we spend per person, we actually underinvest dramatically in Aboriginal health. We've got to have better models for funding community-controlled Aboriginal health services. We've got to have a greater investment in training and ensuring that the Aboriginal health worker pathway is supported. We've got to continue to boost the, this is all in terms of workforce, Indigenous doctors and other Indigenous healthcare professionals, and there's some great work done in that space, and I always enjoy going to speak to the mob there. And then what are some of the evidence-based interventions that we know we can fund simply, quickly, easily, that are going to have most impact? And so I think you sort of got to attack it at all of those levels. But you've got to be committed to doing it. Like, there's a lot of lip service and rhetoric. We don't put the support behind it.
Within the data space, I think it's making sure that we have priorities of Aboriginal and Torres Strait Islander people front and centre. What we're lacking is mechanisms of voice from community in regards to data utilisation. So while we might have overarching principles, it's quite a challenge to put a big blanket approach to the way in which we use data depending on the program of work that's being undertaken. So what we do need to do is develop up, I guess, best models of practice in regards to data utilisation, particularly when it comes to population level data, because I think that that's the abyss. Community level data is pretty straightforward, but when it comes to big population level data, we don't know exactly what's the right way to go about utilising that. Again, it comes back to that question of who are the we in this discussion? Should we be having an overarching body determine what happens on the ground with that data when you don't have representation of the Aboriginal and Torres Strait Islander people within that region? There. So, yeah, we have a long way to go, but we've got a few people on it, I think, and we are having the discussion on governance, and it's going to be a long road, and it's going to be ever evolving, I think. Yeah.
Oh, look, just I think one of those really key moments for us, I think, as organisations, peak bodies that are not First Nations controlled. Where do we fit? And I certainly am encouraging us to absolutely actively back in the advocacy and positions by First Nations organisations. And I'm not suggesting in this room it's what's going on, but we can see some of that of, oh, look, I'm not allowed to be there because I'm not First Nations and so we do nothing, which is actually not what we want either. And so one example, look, extraordinarily offensive policy announcement by the Coalition a couple of days ago where they're going to spend another 100 million plus on rolling out the cashless debit card in the Northern Territory. When National Congress, the Aboriginal People's Organisations of the Northern Territory, all of the First Nations, Nacho, Pat Turner, everybody is opposed to it, and they've just gone ahead and done it. And so for us, it was really important to come in behind, to come out in front and alongside and back in some of that because, of course, some of the nastiest policies get played out, particularly in the remote areas. You know, the CDP, for those of you that come from more remote communities will know what that is. Some of the really nastiest stuff, you know, human rights sense is being done on Aboriginal land to First Nations communities in a way that would never be done if it was a majority of white fellas, actually. Thanks.
My name's Patrick Marnie. I'm from the Remote and Isolated Pharmacists Association of Australia. And I noticed in Richard's speech that there was no mention of the second largest federal expenditure in health, and that's the Pharmaceutical Benefits Scheme. And within that scheme, there are lots of anomalies that impact greatly on rural pharmacists. We don't get any, there's no addressing those additional costs and impacts in those rural communities. Community pharmacies are associated with remote communities. We're there, we employ, we do the job, we're a part of the community health service, yet it's not recognised. It was not mentioned once in those stories. And it impacts on Aboriginal health as well, and that's where we do a lot of work. And you were mentioning about, Kulinda, was about the registration of people on the Medicare system. They fail to get mentioned. They don't get their CTG. They don't, all of that funding is buggered up. So there is a real need for us as a group to think about the PBS as a process that is important within rural health. Thank you.
I think it's absolutely a fair point. The couple of things I'd probably say about it. We're not just talking about the PBS, but we were talking about the role of pharmacists as healthcare professionals in rural and remote settings, and that's not just about the PBS. It's actually also about the scope of practice of the profession, and I've spoken a number of pharmacy functions. I think the view that we've put forward in working with the profession is that we do need to much better utilise pharmacists and the skills that they have within the health system, and at the moment we don't do that. We've got agreements with community pharmacy that lack transparency, and the community pharmacy agreement is an agreement that is it's a huge area of government expenditure. It's not just about the PBS, and what we don't do is use that agreement in a way to have a very transparent model for how we fund a whole range of community-based interventions run and delivered by pharmacists. So we want to see more transparency in that agreement. We want to expand the scope of practice for pharmacists in regional areas. They're often, again, on the cornerstone of delivering healthcare. I think there are problems in terms of PBS more generally. We're starting to see an increase in the number of people who defer access to medicines just because the co-payment's keeps growing and growing, and it's a huge issue. We have to look at the co-payment, and we have to start looking at ways of reducing out-of-pocket costs. It is in some ways I think it's a tool that's used to ration the delivery of medicines in this country. But I did mention, I think, you know, at a system level, we do spend a lot of money working towards gaining very small, you know, incremental improvements in medicines, and we need to start asking ourselves, are we actually funding things that can provide most impact? But I certainly take your point.
Lynn Madden, I suppose an offer of help, of an idea or an approach in the upcoming election around climate change and helping to engage the whole community. We know that industry raises a spectre of loss of jobs to concerted efforts to address climate change. However, one of the things that unifies people is concern for their health, and we know that there are significant health effects attributed to climate change. We heard that throughout this conference. So using the health benefits of addressing climate change and of supporting people's health is a positive step that can be put into the climate debate, which is, I think, largely underutilised at a political level. So that's a kind of an offer of a suggestion of how to frame during a difficult time to an election that's being pulled in, an electorate that's being pulled in different directions. But also to note that we, as a health sector, are also contributing to the problem. We heard about that yesterday. So really sort of asking Richard your ideas and concepts around helping the health sector become more sustainable when you gain power. Thank you.
So very good question. I suppose a couple of elements to that. We've come out and backed a sustainability unit to try and improve the footprint of the health sector, and we've sort of modelled it on a UK unit that has been focused very much on driving down emissions from the healthcare sector. I think your point about framing the issue as one around healthcare, I think absolutely agree with that. And you know, one of the challenges with climate change is it's seen as a threat that's distant, that's gradual, and doesn't have a direct and material impact on people's lives. And so I think framing the issue around healthcare and the impacts on people's healthcare, so it's a very meaningful impact on people's lives, is important. But I suppose I'd put this caveat. I actually reckon we're winning the public debate, and I think most people now, I mean, if you've lived through the last 5 summers, hottest summers on record, sweltered through the summer we've just had, another record. If you live in Tasmania, you've had bushfires in parts of the country that haven't been, in part of the state, that haven't been burnt before. Now 2 unprecedented years where bushfires have burnt parts of Tasmania that are just not adapted to fire. If you live in Townsville, those horrific floods. If you live in Queensland, the impact of bleaching on the reef. If you live anywhere along the Murray-Darling Basin, the collapse, you know, this is an environment in collapse. If you're a farmer, and I speak to lots of farmers, so I think in many ways people get it. And you only have to look at surveys that demonstrate that there's a growing awareness of climate change, and absolutely the community has shifted. It's the politicians we need to shift. And so that's the big challenge. Community gets it. The community have moved on. It's now a front of mind issue. It's one of the top 2 or 3 issues going into this election. And we are at a unique point where people are demanding action. We had those massive climate change rallies driven by students. There's a lot of momentum here. The real question I ask myself every day is, how on earth do we get the major parties to shift on this? And it's very hard when they're getting big donations. You know, $8 million since 2012 from the fossil fuel industry. Both the leader of the Prime Minister and indeed the opposition leader have had coal lobbyists as their chief of staff. You've got a revolving door where these people leave Parliament and go and lobby for the coal, oil and gas industry. And it's rife in the National Party. You look at a whole range of coal, oil and gas companies, and it's a who's who of the National Party. But don't forget someone like Martin Ferguson, who was the then Resources Minister in a Labor government, is now out there spruiking for the coal, oil and gas industry. I mean, this crosses political boundaries. Of course, there are institutional interests within the Labor Party, one of their unions, has been very vocal in opposing any plan to put the brakes on the expansion of the coal industry. So the question for us is, I think we've actually got people with us. I think the community get it, but actually we've got to start putting some heat on both major parties. And so, I mean, surprise, surprise, I'm going to give you a political pitch, but send them a message. Use your preferences in a way that, if you don't want to see this government returned, that doesn't mean you put a 1 next to the Labor Party. Vote for parties that actually have got a strong position on climate change. And put your second preference next to, and send a really clear message that way. Don't forget that the Senate's really important. The Senate, obviously focus in an election campaign is who's going to be the next government, who's going to be the next PM, but the Senate plays a really important role. And so in the Senate, it's really going to come down to a contest between the Senate, where it's the Labor Party almost certainly going to be elected, unless something disastrous happens. I think we are going to see a Labor government, not a moment too soon, in my view, to see the end of this government. But what happens in the Senate? Are they going to be negotiating with One Nation? Are they going to be negotiating with Conservative parties? Or are they going to have a Green, dominated Senate, really putting pressure on them and making sure that we do see the changes necessary? The problem with the climate change debate at the moment is the benchmark's been set by the Liberals. And so, pretty easy benchmark to get over, but it's not up, we haven't seen any of them rise to the challenge, have a renewable energy target that's anywhere where it needs to be, address the issue of coal, and really start to talk about what a managed transition looks like.
I would agree with Richard. I was on a few things today, actually. I have enormous faith that the community, armed with the right knowledge, makes really great calls. The majority do. There's no question. And I think there's a very solid understanding of climate change, and any political party that's losing credibility on policies on that front is in trouble, as they should be. I think it's a bit trickier around energy policy and what's really going on. I think that our view is that people are genuinely pretty confused about it. ACOS has an ongoing, we do a lot of work on climate and energy policy because it is a social justice issue, and there's no question that it's going to be low-income people and communities that are first and worst affected every single time the ravages of climate change hit, and we know that's been played out every summer and winter that goes on now. But I want to just leave you with one fact, which is really crucial because it riles us at ACOS every time we see our friends on the hard right be the ones to stand up and say they care the most about energy bills and how they're hurting people on low incomes. Because we're the advocates for people on low incomes and what's really good policy. The biggest problem about energy bills actually is both income policy and the living conditions, your control over your environment and for the situation for renters. So we've done the modelling on what's happened to the size of the energy bill over the decade as a proportion of your income, and the only group is actually paying a lot more than they used to are people on low incomes, because the incomes are not going up. That's the first point. And the second is that the energy use is through the roof for people in poor rental properties. And that is what in the end means that your bill is unbearable, because you get crappy floor cover, window coverings. You don't have any ability to get any of the benefits over distributive energy, solar panels and all the rest of it. We persistently say this to the major parties about not putting all the money into measures that are helping people who already own their homes, because it's actually people on low and modest incomes in rental properties that are really crushing. And in the end, that is the big issue. It is not about keeping coal fire burning. That is the worst thing we can do. And we're also very clear, we're so strongly opposed to doing anything other than getting as quickly as possible to full renewable energy sources. Thanks.
And I'll just quickly talk to the measurement, so health and climate change. It is really hard to understand the causal or the effect of climate change on health. So unpicking that provides this quite unique opportunity. This is a holler out for any potential data nerds in the hood, to start developing that up. We need to start delving into that information. We have got already, we've got a whole bunch of targets and we know what we need to hit, whatever it might be. But when it comes to the impact that it has on our lives, we need to be developing up indicators that make sense to us. So, and I'm not just speaking about us as in Aboriginal and Torres Strait Islander people, but the community as well. This does affect where we live, how we live, and we don't report on that. So we kind of need to start having that discussion a little bit more, and we need to be pushing those indicators out there.
All right. Thank you. I'd like you to thank our three presenters. We are out of time. Now, in preparation for our final performance this morning, you're not going to hear from me after this next little bit. I'd like to invite Kelly Drummond-Cawthon to the stage. Excellent.
All right, my friends, you've been sitting for a while, yes? So we're going to play a quick game while the chairs get moved. You can do this sitting or standing, right? When I say walk, you walk. If you want to stand up, do that now. And you're going to walk in place. Just move the feet for me. Right, left, right, left. You can do it sitting too, yeah? When I say stop, you stop. Walk. Stop. Walk. Stop. Fantastic. You're so good. Okay, now when I say stop, you walk, and when I say walk, you stop. Stop. Walk. Walk. Stop. Stop. Ha. Keep stopping, my friends. Fantastic. Now when I say sit, you sit. Sit. Walk. No, you stop when I say walk, and you walk when I say stop. Fantastic. Everyone stand up and stop. Walk. You're getting better. Okay, when I say shake, you shake. No. When I say shake, you sit. Sit. What would you do? Yes. Fantastic. One more time and stop. Walk. Stop. Walk. Fantastic. Sit. And shake yourself down. Very good, very good.
All right, I'd now like to welcome Josh Arnold, who's a singer, songwriter and producer, and the fantastic conference choir to take us out to morning tea. So take it away.
Thank you, everybody. This is very exciting. Thanks for those who are here to watch this performance this morning, which is, I'm very excited to present this song that has been created. It's a really exciting and daunting at the same time experience coming down to a conference. So on Sunday we had nothing but a slight idea of what we wanted to write a song about. And I was joined by most of the choir that are made of delegates. So this is a voluntary choir of people who you may have heard in the morning singing and performing, who helped me write this song. And so together we wrote the chorus, which you're about to see on the screen, and the verse to this song. First verse. But then what was really exciting, I went to visit a couple of primary schools who, firstly Denelli Primary School, who wrote their own verse to join into this song. And then yesterday visited Risdon Vale Primary School, who until yesterday had not heard the song, and we wrote a verse yesterday. And here we are on Wednesday, ready to perform a song that was thin air on Sunday. So I think that's really exciting. The song's called Better Together, and I'm really proud of the lyrics, and I hope it can do some real good and potentially make some change, because I think music's an extremely powerful tool and potential weapon for change. So hopefully this song is the start of something really important and special. If we could have the words up on screen, please, if that's okay. Thank you. Can you hear us calling? Coo-wee! Can you hear us calling? Coo-wee! Can you hear us calling? The voices of the wise, the voices of the young, the voices of the land united as one. We are better together, better together. Can you hear us calling? Coo-wee! Coo-wee! We are the voices of the wise, voices of the young, voices of the land united as one. We are better together. We are better together. Spin the compass across cultural lands, rivers to mountains, tropics to red sands. Landscape paints a picture of who we are, people and places near and far. Across the country, rising with the sun, challenges we face will be overcome. Unite for our health. Can you hear us calling? We are the voices of the wise, voices of the young, voices of the land united as one. We are better together. We are better together. Stand up for the small towns. Nothing will keep us down. It's where we belong, where the Aussie spirit is strong. On our track. Next, we got your back. Coo-wee! Coo-wee! Can you hear us calling? Coo-wee! We are the voices of the wise, voices of the young, voices of the land united as one. We are better together. We are better together. Stand up for community. We are just like family. Because all we are the same. Together we can make a change. That's right. Mate, we've got your back. Coo-wee! Coo-wee! Can you hear us calling? Coo-wee! We are the voices of the wise, voices of the young, voices of the land united as one. We are better together. We are better together. Across the country, rising with the sun, challenges we face will be overcome. Unite for a health. All right. Are you enjoying it so far? We're going to take another step, another leap into the unknown. All right. I know you weren't there at practice in the mornings at 8 o'clock and 7:30 this morning for sound check, which I'm told is early by some of these guys. But you get the chance to join the choir now, okay? From your seats, we can't get you all up on stage. So you've got the words in front of you. There should be no excuse. We've sung the chorus maybe 5 times now. So do we know the melody? We got the tune? Okay, we're going to see how you go here. We'll do a little tester, so we won't. So we're going to see if you're ready or not. All right. That's pretty good. I reckon we can just go one more notch. All right. Can you hear us calling? Okay, guys, we're going to listen to them, all right? Just one more. We are, just you guys, we are the voices. There's astounding voices over here. Is that you, Leanne? No, all right. Sounding amazing. We've got to give them a clap. Now we're going to do it all together, okay? And don't forget the claps. All right, here we go. Can you hear us calling? We are the voices of the wise, voices of the young. Voices of the land united as one. We are better together. Hands up high. We are better together. We are better together. Big one. We are better together. Look at this. Thank you so much for a standing ovation. Please have a seat. Can I get, just because I know there's some really tall year sixes these days, I don't know how that happened. We thought when year sevens went, they were all going to be little people, but look how tall some of these guys are. Can I get my adult choir to come out and stand in front so we can give them another clap, please? Please, adults, come out front. You help start this song. This was a real collaboration. I know not everybody was at the songwriting session, but for those that were, it was I really do take in all the ideas I can. I can't take in every single idea. We might have 100, and I've got to just work with what I can. But the idea of putting a calling out, the calling of voices of young and old, big or small, and all these things was the idea of the group. And Kui being from, now just remind me, from the Darra tribe in Sydney, was a word for calling, Kui, and obviously, and used by the Anzacs as well, brought back to life by the Anzacs. So Kui was such a powerful thing. It's really saying, let's all work together in regional areas, but also a calling for government and support from the metropolitan areas and the decision makers. So it's a call to unity, but a call for everyone to get on board and support people in the bush. And I especially love the lyric as well, spin the compass across cultural lands, which I thought was powerful, which is these guys, I really just helped put the puzzle together. So can we give the choir another big hand? And we'll get you back around the back so I can give the kids a moment too. Thanks. And they've travelled all the way from Denali. Denali Primary School wrote the second verse. Their school, please give them a hand. I know we're nearly out of time, I'm sorry. School burnt to the ground, how many years ago was that? 6 years ago their school burnt to the ground, and you were 2 years in little portable, was it quite crammed and small? And the resilience of the community, I dropped into only because it looked like a really nice pub, dropped in for a soft drink on the way home, and talked to the locals and just talked about some of the stories there who were in the pub. And so it just sounds like such a fantastic place and a fantastic little part of the world. And then I went over to Risdon Vale, which is sort of in the country, but a nice little suburb on the outskirts of Hobart. And it was just wonderful to hear about the community spirit there as well. You know, being just a little outer suburb of Hobart, sometimes these little places can get forgotten. It's so important, these little outer suburbs, which I see as close cousins to the country kids. So Risdon Vale did an amazing job as well. Thank you. So we've been asked to sing you on your way to morning tea. So I'm sure you're hungry. So you can sing out the door if you want with us. So here we go, guys. Can you hear us calling? We are the voices of the wise, voices of the young, voices of the land, united as one. We are better together. We are better together. We are the voices of the wise, voices of the young, voices of the land, united as one. We are better together. We are better together. Thank you. And thanks, Leanne.